I hear this all the time. Dr. Kim, I want a change, but I want to look natural. So, what does that mean for the patient? What does it mean for the doctor? And what does it mean for the process of achieving that change that still looks natural to you? We'll dive into all this in today's episode of the You Are Beautiful podcast.
You Are Beautiful, podcast with Jae Kim, ND.
Welcome to the You Are Beautiful podcast with Jae Kim, MD. I'm your host, Dr. Jae Kim, a double board certified facial plastic surgeon in the DC metro area. I am on a mission to make the world a more beautiful place, starting with you. To maximize your beauty, tune in, and we'll go over all the details of what it means to make a natural change for your most beautiful self. Let's do this. So my patients ask me, Doctor, I want to change, but I want it to look natural. So what does that mean? Well, maybe it's easier to start out with what it does not mean. So an unnatural change can, for example, be a windswept facelift like this. Or it can be an overdone rhinoplasty where a medium-sized nose becomes super small. And not only does it not fit your face anymore, but it's much harder to breathe. It can also be an aesthetic treatment like Botox, where you got too much and you look frozen. So your kids can't tell whether you're angry, happy, sad, whatever it may be. And yet another example is you have too much filler, let's say augmenting your cheeks or augmenting your jawline so that it looks more block-like instead of your natural shape. So when you think about an unnatural appearance, there are plenty of examples on social media, from Instagram to TikTok to a lot of influencers and celebrities. And part of why they do that is for the clicks, the likes, the views, and that's kind of their MO. Now, for a lot of my patients, they're not necessarily going for the social media appreciation or accolades. Instead, the motivation is more behind wanting to see a more beautiful, younger version of yourself in the mirror every day. So when you think about that, it's really the idea of I want to look like a younger version of myself, a more vibrant, youthful version of myself. So when you think about a natural appearance, you definitely want change. So that's why you come to someone like me, a plastic surgeon, an aesthetic professional who knows beauty of the face and neck and can tailor your treatment program to the goals that you have. So some goals might be to have a little bit more of a jawline or have more chin projection, or you might want a slightly more voluminous face because you're on the thinner side and you tend to lose fat in your face and look droopy and saggy. So these are some of the things that may be on your mind. Now, in terms of what a natural change means for aesthetic professionals like myself, is that I want to make it a process such that sometimes it's an incremental process towards achieving that goal result that you're going for. So we have things like injections, and we have things like lasers, we have things like other aesthetic treatments that can help you get to achieving that certain goal that you're going for. And when you think about a natural appearance, you're still maintaining a semblance of the normal color of your skin, the one that you were born with, maybe minus the tan, of course. When you're looking at your brow position, you're not going for a super high appearance. Maybe you're going for a slightly more lifted look so that your eyelids can shine through a little bit better. And then when you think about your eyes themselves, any kind of extra skin or fat bags or dark circles, those are the things that you want to change. So when you think about people who have had bad facelift results, it's usually because they're pulled too much and or they've been pulled too many times. So generally we say that you should only go to the well, i.e. have surgery every 10 to 15 years for facelifting purposes. The areas where we want a little more natural change is along the mid face because the amount of descent in the mid face is relatively minimal compared to the amount of descent along the lower face and the neck. Therefore, a relatively smaller amount of lift can have the desired effect in and around this cheekbone mid-face area. When you get farther down into the face, lower face and the neck, you're going for a more dramatic result. So saggy neck, double chin, jowls, those are the things that you can really have a dramatic effect and it can still look natural. So natural and dramatic can go hand in hand. When you look at certain patients who have really big jowls, really saggy necks, really visible muscle bands, platysma bands, you look at their afters and you think, oh, they look like that all along. And the great thing about it is a lot of people who may see them afterwards, who may see my surgical patients afterwards, do think, oh, they must have looked like that all along. And they don't think twice about the idea that they might have had a facelift. So that's what my patients really like about it is that it still looks like them in the end. And people don't really think, oh, you had work done. The stigma around plastic surgery is a lot less than before because everybody is inundated with plastic surgery stories on the internet and social media. However, you still don't want that, oh, you had plastic surgery done. I mean, unless you do, of course, but that's not for everybody. I think that when I talk to patients who have this goal of, I want a natural change, I think what resonates with them the most is you want somebody to notice that something's different, but not know exactly what happened. And that's a lot of the comments that patients who come to me for surgery get after they've had treatment with me and my staff. Some comments that you might hear after you have an aesthetic procedure or plastic surgery, it might include something like, hey, did you sleep some more? Have you been sleeping better these days? Or, hey, are you using different skincare products? Or, hey, did you go on vacation recently? You look refreshed. That's the kind of feedback that my patients like to hear because they know that, hey, somebody notices, but they don't know what really happened. Creating a change with plastic surgery, but also having a natural result, a big component of it is that you still honor your heritage, your ethnic background. So, as a person of Asian background, I would not want my nose to look like a white person's nose, or a Latino person's nose, or a black person's nose. Certainly not a Middle Eastern nose. You know, no disrespect to how their noses look, but that nose on my face would just look very weird. Okay. And so, when it comes to surgical results, especially rhinoplasty, you have to be sensitive to your ethnic heritage, your cultural background, and what that means in terms of the desired final shape of the nose. As you know, a lot of Asian people have plastic surgery, both in the States and abroad. Arguably, the mecca of plastic surgery is Korea. So it's not unusual for, you know, teenagers to have double eyelid surgery and rhinoplasty as like an 18th birthday present. So the question that then arises is, if you don't have plastic surgery, are you looking unnatural when you're comparing yourself to your peers? Now, that's probably a more rhetorical question for another time, but suffice it to say that a lot of people in popular media, but just in general, a lot more people are undergoing plastic surgery and it looks like themselves. So when you think about plastic surgery and your own beauty goals, think about it this way. The first thing is, will people notice and not know what happened? Will they just say, "Oh, you look more refreshed," or "Did you recently go on vacation?" If that's the kind of change that you want, I would say you're going for a natural change. Another thing to consider is this change going to be consistent with my ethnic background, with my cultural roots? You want to stay within the bounds of cultural standards when it comes to beauty. Sometimes the change that patients go for is quite dramatic. So when it comes to facelift surgery, some people may have super saggy necks or super big jowls, and you are going for the dramatic in that situation. And so a facelift neck lift surgery is often the best way to get to that goal of achieving a still natural version of you that is more beautiful than when you came in. For some people who want a rhinoplasty, a the change that they are asking for can be quite dramatic. You might have a super big nose and you want a small to medium sized nose in the end. There's probably nobody who knows you who would not notice that change after the rhinoplasty surgery. As a matter of fact, you might feel like the feedback you get might sometimes drive you to ask, why did I do this? So you want to be clear about why you're pursuing plastic surgery. As a facial plastic surgeon who sees a lot of beautiful people in my office, I want you to feel like a more beautiful version of yourself as you develop a relationship with me and my staff in your beauty journey. A natural change, sometimes that can mean an incremental change. Those things are applicable to a lot of non surgical or aesthetic procedures that we have at the office. For example, filler treatment, sculpture treatment, any skin based treatment, including lasers or microneedling, are procedures that are not one and done things, but rather a consistent treatment program so that you incrementally get from point A to point B. So from your current beauty to your desired goal beauty. And the best way to do that is to be diligent about taking care of your health, your skin, and having these procedures done regularly. It's always important to keep an open communication line between your aesthetic professional and plastic surgeon so that you're always on the same page about where you are and where you want to go in terms of your beauty goals. When it comes to some plastic surgery, recovery process can be a little bit tough. And one aspect of that is that because of the swelling initially, there's a lot of ebb and flow in the tissue healing process. And so there are some parts of surgeries that can look very dramatic initially. And it can be a little bit surprising, especially if you have facial plastic surgery. The idea is that you're always looking at yourself in the mirror every day, several times a day, like when you go to the bathroom and when you're on your phone. You're always looking at this change day to day. And so from the day before surgery to the day after surgery, that might be a big change. And it's sudden, right? The time frame is very short. So if you look at it that way, there can be times and situations after plastic surgery where you're a little bit shocked when you look in the mirror. Okay. And that's not unusual. When you have surgery to change your appearance, you are going for a certain amount of change. And that has to be clear between you and your surgeon in terms of what kind of change you want and how dramatic of a change you want, whether that will look like a more beautiful version of you. So, to summarize, make sure that you are on board with your surgeon about what kind of change you want and how the recovery process is going to be. There are some situations where overdramatic results can be hard to undo or impossible to undo. That, along with potential health risks of going overboard, is why it's better not to go for the super dramatic or the unnaturally dramatic. There are a lot of situations where lips get overfilled or cheeks get overfilled. Sometimes even chins or jawlines can get overfilled, and it can create a bottom heavy look that is not consistent with the aesthetic standards of our time. For a long time, we thought that fillers were completely absorbed by the body after a certain amount of time, give or take 9, maybe 12 months, and some situations, maybe 18 months. But the truth of the matter is that there's always a little bit of a residual leftover. Over time, that can accumulate. And by the time you've had fillers consistently for like 10, 15, 20 years, your face will never look the same. So, this is a cautionary tale in terms of filler treatment. Yes, to some degree, it is reversible, but at the same time, there are situations where getting too much of it at one time or having it done for too long of a period of time in your life can lead to an unnatural result. For example, people who have had cheek fillers for 10, 15, 20 years can have permanently high riding cheekbones. Meanwhile, they have saggy jowls, by the time you approach 50, 55 years old, because this overall effect, just the continuous filling of this area using needles or cannulas to place the filler can lead to some injury, scarring, not to mention the minor ingredients of filler just kind of building in that area like residue over time. So think about the type of treatment, how much of it you're having over what period of time, especially when it comes to injectable treatments. One treatment that I will say looks very natural, even when you do it consistently over long periods of times, is Botox, or Tox as we call it. The idea that somebody can have a permanent wrinkle here at the age of 30, right? And you get Botox treatments consistently a few times a year to help relax those muscles that makes the lines that you don't like these guys and like these guys. Over time, I've seen many patients who have tox consistently over 5, 10, 15 years. And what seemed like a permanent wrinkle that they had in their late 20s, early 30s is completely smooth by the time they're in their late 30s, early 40s. So, to that effect, there are some very good aesthetic treatments that can overall have a cumulative natural looking effect over time. And this is not to say that your forehead's never going to move again because, the injection wears off after a few months. But suffice it to say that because you're not forcefully making these lines consistently, you're getting a softer appearance without the deep lines that you would have gotten otherwise. The important point to take home is this. When you want to change this natural, it's okay to get there incrementally until you get to the point at which you say, this is what I wanted to achieve. It's much harder to shoot for the moon and perhaps overshoot the goal and then try to backtrack your way to the goal that you were going for. This is why with every patient who comes to my office, my staff and I always say that this is a long-term journey. It is not a one-stop shop to get from point A to point B. Achieving your most beautiful self is a journey and a process. And my staff and I are here to help you along that journey to achieve the most beautiful version of yourself. Thank you for tuning in to today's episode of the You Are Beautiful podcast with Jae Kim, MD. Please comment and leave a review down below. All the links to learn more about me and my practice are in the description. And if you want to learn about certain topics or for me to invite certain guests on the show, please send an email to podcast@jkimmd.com and I'll be sure to reply to your inquiry. Until next time, you are beautiful, you are unique, and you are worth it. Have a good one.